morning. It's good to know you joining today on Good Morning Abuja, coming to you from the Unity Station, NTA Channel 5 Abuja. And I am Gladys Kudambo Vincent. It's good to know you joining. Yes, it's another day to put a smile on someone's face, another day to show a bit of kindness to everyone and anyone around you. And on that note, we say it's time to take our motivational talk. Yes, I'm sure you've been waiting for this part of the program. Yes, it motivates you and makes you start your day on a right note. Let's see it.
I used to be the guy who had something to say about everything. Every conversation, every meeting, every argument, I was there, mud running, thinking I was proving how smart I was, until one day I realized something that hit me like a lightning bolt. The most successful people I knew, the ones who commanded real respect, they barely spoke. When they did, everyone listened. That's when I understood that words are like money. The more you spend, the less valuable they become. Think about this for a moment. We live in a world where everyone is screaming to be heard. Social media, conversations, meetings, it's all noise. But what if I told you that in this chaos of voices, your silence could be the loudest sound in the room? What if I told you that by choosing when not to speak, you could gain more power than any words could ever give you? The first situation where you must embrace silence is when someone is trying to provoke you. I call this the trap of emotional reaction. Picture this. Someone says something that cuts deep, something designed to make you explode. Your blood boils, your face gets hot, and every fiber of your being wants to fire back with something equally hurtful or defensive. This is the moment where 99% of people fail. They take the bait, they react, they lose. But here's what I discovered. When someone tries to provoke you and you remain silent, something magical happens. First, they don't get the satisfaction they're looking for. They threw their best punch and you didn't even flinch. Second, and this is crucial, your silence makes them question themselves. Did you not hear them? Are you so unbothered that their words mean nothing? This uncertainty is your power while they're trying to figure you out. You've already won.
As that was our motivational talk, I'm sure you are now motivated to start your day. It's now time to take our health tips, our health segment for you. Let's see it.
Today, I'm going to be talking on this very topic, anesthesia. And many people, maybe they don't know the word anesthesia. Maybe they don't know what it even means, not just knowing the meaning. Actually, anesthesia is an act of taking away pain, awareness, and any unpleasant experience when undergoing surgery or in pains, so that you don't feel the pain, you don't remember having the pain. Though the anesthetist does that artificially and is temporary. It's not just about giving the anesthesia to achieve those things I made mention earlier, take away the pain, take away the awareness, or paralyze the muscles so that the surgeon have a good surgical field. It's about knowing how to prevent a possible complications when you administer those medications in the aim of achieving anesthesia. If you are not a professional, believe me, even if I am going to tell you today and tomorrow and next, I'm telling you, you will not know. It's only the professional that knows how to prevent, and if inevitably it happens, he knows what to do to prevent the complication or further escalation of that complication. Because the anesthetist will tell you what you are to expect, the possible complications in details. And the anesthetist will assure you that if at all those complications come, I am competent enough to avert it. And by the grace of God, after everything, if I put you to sleep, I will wake you up. If I paralyze your muscles, I will ensure that they come back to full function before you even leave the recovery room in the theater. So I would advise, if you go to for any surgery, there is no small surgery. That is just the word. Some might say it's just like POMA, they will just incise and remove it from here. Even the local anesthesia that are administered topically can engrave individual's life. You understand? So there is no small surgery. Don't say it's because it is just my fingertips. There's no need to see an anesthetist. You need an anesthetist to save your life, to prevent you from going into the complication that will warrant bringing your life backward. You understand? So always ask for your anesthetist. Being a nurse anesthetist, being a physician anesthesiologist, always ask.
As that was our health segment, I'm sure you've learned a thing or two. Okay, now moving on. Before we continue, let's go on this quick break, and when we return, the program continues.
Hey friends, welcome to Kiddie's World. My name is Ogunta Ambush Justina.
My name is Omar Darius Erison, and today we're going to start off with our usual exercise, and today our exercise is swimming.
Welcome back. This is still Good Morning Abuja. Yes, it's now time to take a feature that has something important to tell you. Let's see it.
Many humanitarians are philanthropists gifted with the act of giving. They major in providing free healthcare services, potable water, shelter, and many more, just to make life better for the less privileged.
What make us, give all that empathy, towards fellow human being is the fact that the moment you see everybody as very important personality, the more we make our society free of rancor, free of enviness, free of danger.
As people who work in the humanitarian space, we identify those needs and we meet them. Of course, it's a great burden. It's there because it's there. That's why we are doing what we do, because there's a whole lot of need out there that are not being met, undeserved, underserved people.
That's why 19th of August every year is marked as World Humanitarian Day, to honor aid workers and to draw global attention to communities in crisis.
No matter how they presented the matter to you, just for the sake of humanity, just look at it from the angle that there is a need somewhere. And when you do that, it comes with peace of mind, it comes with joy in your heart.
We are all human beings. We have the same common humanity that flows through us. So let us reignite that concept of who we are as human beings and reach out to one another in times of need and in times of care, and be our brother's keeper.
With the theme Strengthening Global Solidarity and Empowering Local Communities, the day seeks to call for the delivery of humanitarian aid to the roots, regardless of political or religious factors, thereby reducing the World Bank's figure of poverty line below 9.9%.
That was a lovely feature there. I'm sure you learned a thing or two. Now, moving on, it's time to meet our guest. But no, you go on the quick break with me, and when we return, you'll meet our guest.
I don't know what it is, but she drives me crazy. Marriage, a beautiful bond, but not without its battles. Behind every smile is a story. Behind every I do is a journey. Mr. and Mrs., the show that peels back the curtain on real relationships. No scripts, no filters, just truth.
I've become a better husband because I've learned a lot from the mistake of the past.
I had feelings, but I wanted to be sure.
Do I have to kneel down to marry a woman?
No, but just do the right.
Join us every week as we sit down with real couples to talk about the raw, the real, and the redemptive side of marriage. This is Modern Entertainment. It's an invitation to grow, to heal, and to love again. Mr. and Mrs. is about real love, real struggles, and real hope. Every couple has a story. What's yours? Join us on NTA Channel 5, the Unity Station, every Thursday at 7:30 p.m.
'Cause all of me loves all of you.
This is still Good Morning Abuja coming to you from the Unity Station, NTA Channel 5 Abuja. And yes, my guest is here with me. Like, it's now time for our conversation, and she's a pretty one. Yes. She's a pretty one talking about a topic that is actually for everyone. When I mean everyone, everyone, because it's either you have a mother, a sister, an auntie, like, name it, it has to do with you. So if you are aware of this, you do better to actually inform others. Okay, what am I talking about? We are talking about maternity health as regards pregnancy. And my guest is Olivia Onosike. She is a nursing student. So together we're going to be talking about this topic. Welcome to Good Morning Abuja.
Thank you, ma'am.
Nice having you. Like we're having you alone. We have hope. We know that we're going to learn so much today. Okay, so thank you for coming. Talking about maternity health, like looking at pregnancy now, pregnancy is actually a beautiful journey,
Yeah.
but it can also come with many changes, especially first time. But sometimes we say pregnancy actually is different, whether first, second, third. But usually it's good to know first things first. What should a woman expect when she becomes pregnant for the first time?
Okay, so before we go into what she should expect, let me
Okay.
just simply go through what pregnancy is.
Yeah.
And this is where a woman takes in,
Okay.
or let's say the sperm of the man fertilizes her egg, and then she has a baby growing to her womb. So from when the baby is growing down to when it is born, that is known as pregnancy.
Okay.
Now, yes, it comes with changes in the body because a life is growing inside her. So definitely the body has to adapt and adjust to this new life that is growing inside her. So definitely there will be changes. But the one that is common to many is, first of all, she stops seeing her period.
That's like the first.
That's like the first sign.
Most time.
Yes. And then she has what we call early morning sickness, where she throws up from time to time. It's normal. It comes with the body adapting and adjusting.
But is that for everyone? Not everyone actually complains of having morning sickness, but I think that's like a major.
Yes, it's not for everyone. Like I said, each individual adapts to pregnancy differently.
Okay.
So definitely it's not for everyone, but this is ones that are common amongst most women. Right? You also have some persons, they start having different mood swings. Yes. So start having weird cravings.
Wow, I can imagine.
This is just their hormones trying to adapt.
For pineapple from the moon.
You understand? Okay. So it's different with each individual, but these are the common ones that we see on a day-to-day basis.
Wow, okay. So now you have given us the basics and then what to expect as a first timer, getting pregnant for the first time. And then so you don't see it as being strange. Are you sure I'm normal? Are you sure?
Go and check.
Okay, so many women experience different physical and emotional changes during pregnancy. What are some of those changes they should not be worried about?
Okay, so I'll start with the physical and then I'll move to the emotional changes. So for the physical changes, for some women, not everybody, for some women, they might have dark lines in their stomach.
Okay.
Yes, some in their breast area. It might be there, but usually it clears after they've given birth for some women, like I said. Now, for some, they might have maybe swollen feet. It's normal, it happens. So these are some common physical changes. Then for the emotional changes, is a lot.
When you wake someone at 1 a.m.
and you just start crying,
crying.
and you can't explain exactly why you are crying.
Exactly.
So women body is a very magnificent. It's a very magnificent place. Honestly,
I can imagine crying and be like, what
why
did
are
I
you crying?
do?
You can't even explain why you are
crying.
crying. It happens, right?
Talk
But
of people
then,
around you.
yes. And then sometimes they can just be happy, sometimes they can be crying. Sometimes you just say that they just want to fight.
Mm.
Can't really blame these people.
Wow. I can imagine.
You can't really blame them. But these are the things that are common among women. Mood swings, like I said earlier. And then for some persons, you start having back pain.
Okay.
The stomach start growing bigger and bigger as expected. Some grow bigger than others.
Yeah,
Like some, you might not notice they're pregnant till like 6 months. Some in the third, fourth month, you're already seeing.
Like,
yes. So, but it really grows bigger by each month. Then around 4 to 5 months, they start feeling the baby kick, move, and things like that. So these are common things that they're not really a problem, but they're things that they see. And the early morning sickness too is normal, but then it becomes a problem when it is too frequent. Then they just have to just check and know what's going on.
Okay, you mentioned sweet feet swelling, and then
Yes.
we have some instances where you see the before and the after facial look of the mother is like two different worlds apart, because I don't know,
Yes.
the face is something else. That's swollen. Sometimes it looks like a different person
Person
entirely.
entirely. Well, in as much as people interact with pregnancy differently, when you notice that your whole body is beyond normal adding weight, because definitely as the baby is growing, your weight it will be increasing. It's normal. But it's not supposed to, by normal standard, it's not supposed to increase beyond 12 kg.
Oh, really? That's
Yes.
your child's body weight or your body weight?
Your body weight and the child body weight together.
Okay.
You get, but generally you're not supposed to increase beyond 12 kg.
Oh.
But then when you now start seeing that, okay, my hands are getting swollen, my face is getting swollen, my whole body is swelling up, then it can be a danger sign. So ask. So that is where you now need to, maybe when you go for antenatal, you ask the doctor or the nurse or whoever you interact with at the clinic. Okay, this is what I'm seeing. It's better to know and know that you are safe, than to just feel like it's one of those changes and then it's actually a serious issue.
Okay. So when should an expectant mother begin antenatal care, and why is it so important?
Okay, I'm going to say that immediately she finds out she's pregnant.
Immediately?
Yes,
Wow.
within the first 3 months if possible. Because pregnancy comes with a lot of changes, and for some persons, they need pregnancy comes with a lot of changes, like I said, and this antenatal care helps you to keep it in check, to be able to find out the risk early.
Especially a first timer.
Yes, in case of any abnormality. In case, okay, for someone who is not a first timer, for example, but let's say a woman who has a history of, let's say, high blood pressure, she needs to, doctor needs to know.
No. Okay.
So that they will know how to attend to her.
Okay.
Because it actually can become a serious issue.
Okay.
People who have underlying health conditions, be it diabetes, be it hypertension, anything at all. Or let's say she had a complication in her previous pregnancy. She has to mention it, and it's when they come for antenatal that they can do that. They can now see the doctor, so that if there is any risk, it is detected early
and managed well.
To save both the mother and the child.
Wow, that's a good one. So antenatal, you see some people saying, if I go there now, they will tell me the same thing. Like, it's just like they see it as a waste of time, especially those that have, maybe they have one or two or three children, and then they see like a normal, and then maybe, especially if they are lucky, because there are instances where you see them not registering till maybe 6 months. In fact, some will even come at 8 months,
just so that they
and
can,
then you hear the nurses telling them, you don't know you can give birth at 7 months, and why are you just coming? Some would even want to reject you. So, but now we see the importance of
starting early.
starting early. So Some women, as I said, may not take antenatal visits seriously, especially when they feel fine. So when you visit, what are those, when you go for antenatal, what are those regular, or should I say, what are those things that actually happens? Or should, because I don't know now if it should be some instances, some particular healthcare, the activities that are supposed to be in an antenatal session, what are those normal?
All right. Amongst other things, they
Mm.
gave them health talk,
Okay.
help them to take care of themselves. The fact that you are pregnant doesn't mean you should leave hygiene in the background, right?
Okay.
So shows them how to take care of themselves. Then it also helps them allay fears and
Okay.
some of the usual myths that is in the society that are not true.
Okay.
Yes. And then it's the health education is a very, very vital aspect because it gives them idea on what to do, what to avoid, in case they see something that signifies danger, what to
Okay.
do in
What
those
to do?
situations.
Oh.
You understand? And then antenatal days are fun
Oh,
at the
really?
hospital. Yeah, used to
Really?
dance, used to clap.
Okay.
So all those little activities
Yes.
helps
Dance
the
with
body.
pregnancy.
You
Okay.
know, gives
Okay.
the exercise, the lights, not serious. You know,
One.
we
Okay.
sing, we
Just to
dance. You
make
know,
you.
it gives you this light exercise that helps your body.
Okay.
You know, it's not something strenuous, but it helps you as a pregnant woman.
Okay.
And then after that, they usually check their weight,
Okay.
they check their height. Yes, so they compare it to previous data
Okay.
to be sure that everything is on track. They check their blood pressure.
Mm.
I mentioned earlier that now for those that might not want to go, maybe because they've had previous children, if your baby is not growing, you will not see it. You
That's
understand?
another one.
You might feel fine, but you will not see it. And if an intervention is not done as soon as possible, you might lose that child.
Wow. Okay.
Also, if and is when they check this weight and all of that, that gives them data to know. And then sometimes if your blood pressure is higher than usual, you might not know until it becomes an emergency. But when they go for this antenatal, their blood pressure is checked, is also compared to the previous one to know, okay, is this still in range? Is this still within range?
Okay.
If it's not within range, what can be done now?
Now. Okay.
So that saves the mother and that saves the
Wow, I
child
remember a
because of
case.
early
Yes,
intervention.
I remember a case where someone came for normal antenatal visit, and then she, when after checking the vitals, it was discovered that like her BP was at the bar, and she wasn't feeling nothing. Like she felt normal, everything was okay with her, and they were telling her, the nurse was telling her, sit, like sit, just make sure
Just
you
sit
are.
down.
She said no, she wants to go. And they said, do you know what's happening to you right now? Like, okay, she was waiting to see the doctor. Immediately the doctor, well, as in when immediately checked her, it was like she should call home and tell them to bring her. He's booking her for an emergency. Yes.
Yes.
Like she was shocked. Like it was like you can drop here and die. Like that is how bad
And
it is.
that's
So
it,
imagine
yeah.
if she was at home saying
She
she's
feels
normal
fine.
and
You
okay. Okay. So
understand?
I see, or we see now the importance of antenatal visits. So
Yeah.
are there certain food, drink, medication, or activities that pregnant women should actually avoid?
Yes. So
Okay.
first of all, I'll start with the medication.
Mm.
And that is because when you're pregnant, you cannot be too careful.
Okay.
So there are some certain medications that we call, they have dual effects. They have more than one usage.
Oh, really?
Yes.
Okay.
So there are some that should not be given to pregnant women at all.
That's all.
Even if on a normal day you can take it, but as long as you're
You're
pregnant, don't try it.
Wow.
Now let me give an example. So there's this drug called misoprostol that they use for ulcer patients.
Okay. Well, like someone that has ulcer.
Ulcer,
Oh,
generally,
really? Okay.
yes, for
Okay.
ulcer patients. But then it was later discovered that it can also cause miscarriage and abortion.
Oh, really?
Now, for example, now a pregnant woman who has ulcer
Mm.
and is taking this drug, there's high chances that she might lose the child.
Mm.
But she might not know because it might be her usual or regular
Yeah,
ulcer
ulcer drugs.
medication.
Wow.
So whatever drug she needs to take, she needs to confirm if it is safe
Safe.
for
Wow.
both her and the child. And that's
Okay.
for medication. Now for drinks, she should leave caffeine, coffee.
Total.
I think God better my
Like
yeah.
totally. Okay.
She should leave caffeine.
Okay.
And then alcohol too.
That's a
It's
no-go area.
like at all.
At all.
Smoking, tobacco. Just give
It
birth
has,
first. It has nicotine and
okay.
other substance in it that not just affects her as the mother, it also affects the child. For you start seeing children with Down syndrome, it could be one of the contributing factors amongst other things.
Oh wow.
Right? And then for food, okay, so I don't know how common you might know this, but there are some people generally that maybe you just see one leaf on the street and you remember it and you just plug it, carry pure water, do like
Wash
this.
it and eat because it's natural. Wow. I can imagine.
Don't.
Don't.
Even if the urge is there, you don't try it.
What if it's pregnancy craving?
And no, you should not be the one that will kill us now.
Okay, so let's go on this quick break and we'll come back to this conversation. Yes, it's been a wonderful one. Like there are some cravings you will not understand. Okay, so but let's go on this quick break. And when we come back, the program Good Morning Abuja continues. Don't know where.
Are you interested in being up to date with the pacey world of sports? Our rebranded Capital Sports is the finest bet for your doing so.
So, join us every Thursday live at 3 p.m. on NTA Channel 5 Abuja to talk sports for your viewing pleasure. Remember, you can be a part of this #1 sporting program. Join us on the analysis, views and opinions.
I don't know what it is, but she drives me crazy.
Marriage, a beautiful bond, but not without its battles. Behind every smile is a story. Behind every I do is a journey. Mr. and Mrs., the show that peels back the curtain on real relationships. No scripts, no filters, just truth.
I've become a better husband because I've learned a lot from the mistake of the past.
I had feelings, but I wanted to be sure.
Do I have to kneel down to marry a woman?
No, but just do the right thing.
Join us every week as we sit down with real couples to talk about the raw, the real, and the redemptive side of marriage. This is Modern Entertainment. It's an invitation to grow, to heal, and to love again. Mr. and Mrs. is about real love, real struggles, and real hope. Every couple has a story. What's yours? Join us on NTA Channel 5, the Unity Station, every Thursday at 7:30 p.m.
'Cause all of me loves all of you.
Hey friends, welcome to Kiddies World. My name is Oguntayo Justina.
My name is Margaret Erison, and today we're going to start off with our usual accent, and today our exercise is singing.
This is still Good Morning Abuja, and if you just joined in, you've not really missed because we still are waiting for you. Yes, my guest is still waiting for you to tell you more because you need to know it. We're talking about maternal health relating regarding to pregnancy. Yes, she has told us a whole lot, but she still has more for us. Okay, so how important are adequate rest, sleep, and safe physical activity during pregnancy?
Rest and sleep is very important. Beyond pregnancy, even for you as human beings, there's a certain level of rest you need to have between 7 to 8 hours daily at least.
At least, okay.
Right. So even for the pregnant woman too, she needs rest because her body is changing. A lot of things are happening. So that is not the time for her to overwork.
Okay.
But at the same time, that is also not the time to just completely relax and not do anything. So there should be a balance.
Okay.
So while she's resting well, she should also take time to do light exercises, take a walk, do some of the house chores, not pounding yam, sha.
Even when you are craving for
you get
pounded yam.
no, well, you get what I'm saying.
Yes,
So light exercises is recommended. It helps her a lot. It also helps her down to when she's going to deliver. It keeps her fit and all of that. So light exercises with adequate rest and sleep, there should be a balance in between. So she can walk, but she should be careful. She should remember when to rest. When her body says she should rest, she should just rest.
Okay.
Right? So that way she can stay up.
Okay, so saying when your body says, some people will not understand when the body says you should
The
rest.
body does not say
So what?
in the evening rest. If you can in the afternoon for some person,
Yes.
please do, but it might not work for everybody
Mm.
because of people work schedule and all of that.
Okay.
But if you can in the afternoon rest, but make sure that at least at night get at least 7 to 8 hours of sleep.
Okay, so what are those warning signs during pregnancy that should make a woman seek medical attention early?
Okay.
Immediately, sir.
All right. So there are several signs that come with pregnancy, but let's just do two at once. So I'll talk about the emergency one and the one that she's going to see that are not necessarily an emergency case. Right? So for the emergency case, bleeding from the birth canal, bleeding is number one. Like if you see it, regardless of when the pregnancy, how long you've gone, immediately seek medical attention. Bleeding is the number one. So for some persons, beyond bleeding, if you're feeling pain in the stomach area, the pain is not going, is recurring and persistent, please seek help.
Okay.
Ask for help. And then for also, if you're having high temperature, fever that is not coming down, also seek for help because sometimes fever can be a sign of infection.
Okay.
Yes.
Okay.
So she needs to go and check, and it is urgent so that it doesn't affect either her or the child, and then she ends up losing the child. Right. So these are the major warning signs. There are a lot of them. I mentioned some earlier, like swelling of the whole body, the face, the hand, the feet. Also, in as much as nausea and vomiting can be normal, if it is too persistent where she can't keep food down for, let's say, for a few hours or for 24 hours, she keeps throwing up, it can become an emergency case because she's losing fluid, she's losing electrolytes, she needs to seek attention immediately. Right? So that is an emergency case. Another one, this might not be during the pregnancy period, but another one could be, okay, this could be, there's something called ectopic pregnancy. This is where the baby grows outside the womb. Right? So in this situation, she can't know because she's not seeing it. So that's why when she's feeling those pains, she needs to seek urgent care for her own life and for that of the child.
Can something be done at that point?
Well, she needs to seek medical intervention. In some cases, probably, but if not, she'll be advised on what to do. Right? But that is why she needs to go early so that if there's anything that can be done, it will be done early before it goes beyond what medical intervention can
do. Okay, so what is a birth preparedness plan and why should every pregnant woman have one?
Okay. Now, a birth preparedness plan is the plan that a woman should have before labor.
Before labor.
And not just before labor. Like, I see it as pregnancy takes 9 months. You have 9 months to plan. Right? You have 9 months to plan. Even if you did not notice it early.
Exactly. I was going to say that. Some people don't know they're even pregnant.
Till like the 3rd month. You have up to 6 months to plan. So, regardless of what, start with saving money. You need it in case. Then now decide with your family, with your husband, decide where do you want to give birth. Which facility, which medical or health facility do you want to give birth? Are there emergency numbers that you can call in case? Now those emergency numbers could be your doctor's number, it could be your nurse number, it could be your driver's number, it could be your husband's number, because sometimes it can happen anywhere. But then yes, it could be your neighbor's number. So there should be numbers on speed dial in case. So then in case of any emergency, you have who to call. right? And then you can now buy the basic baby things, like the
Okay.
baby clothes, can buy sanitary pads, a few clean clothes, just something what you would need for the delivery. You can
Okay.
prepare it ahead of time because sometimes, okay, so pregnancy goes between, some people give birth at 37 weeks, some between 37 to 40 weeks,
Okay.
right? Now, let's say the woman is not even, she didn't know that, okay, her own is going to be 37 weeks, because sometimes you won't know. And then it happens, and then she has not bought anything. Then everybody's running, and if there's no money at that period, it is a problem. But when you start planning early, you start saving up small, small each month, even if an emergency occurs, there is funds at least to give for starters, at least for that emergency period, right? And in cases where you now realize that this woman might not be able to deliver by herself, she has to go through CS. In those cases, there will be funds available for those kind of emergency cases, right? Because that period is a delicate period. Human's life is at risk, the child life is at risk. And in some cases, if they don't do that immediately, you might lose the mother, and lose the child. So saving money, even if you don't need to be a rich person, so you know your income capacity, your family's income capacity.
That's why you
You
save
start,
early.
yeah. So start early, plan, and then when it's time, you'll be ready.
Wow. Okay, that's a good one. So why is it important for women to give birth in a health facility or with the assistance of skilled health professionals? Because some people prefer, maybe they don't have the money or they feel going to hospital is a waste of time and then they just want to do it
In
at
their
home.
house.
In fact, some people, especially when they've succeeded in the first one, it's like a normal. You don't need to. After all, I even gave birth. You hear some people say, I gave birth. I've given birth on the farm before, so it's no big deal. And in fact, you hear some people even still saying like, I've given birth by myself, nobody else around, and they feel it's an achievement. Okay, so why is it important for you to visit health facility?
Because you can never be too careful. You can never be too careful. What if complication comes in?
Exactly.
The hospital facility is well equipped to handle it and save the mother and the child. What if something else comes up? There are a lot of what ifs because you don't really know when what will happen, right? Emergencies can come up. And now, if you have a skilled person, the person will know what to do because this is a person that is trained professionally. So they know what to do and they know how to go about it. They know what tools to use and the tools are readily available. So it is like giving you like an 80% chance of survival, even if something comes up.
Wow, that's good to know. Okay, there are many myths and misconceptions about pregnancy. What are some of the common ones that you would like to correct?
If you eat egg, your baby will smell.
Hey. Okay, some people say if you drink some of these things, okay, maybe your baby becomes big. Like, don't eat. You need to starve yourself. You don't eat too much.
Don't starve yourself. Oh. Some will say if you tie your stomach will not be big. It's a lot. But okay, some might also say this is a general one that happens. Like woman should not have sex during pregnancy.
Okay.
It's a myth. It's a misconception because sometimes that activity aids her labor process and even her delivery process because it widens the birth canal, right? But then she might have to maybe talk to, maybe when she's along like 6, 7 months, the baby's growing, might have to talk to her medical professional to know how to go about it.
Okay, okay. So some of these myths, they are fair though. They are myths, so don't starve yourself. Eat very well.
Eat, yes.
Some people say, I remember one saying, like don't take all this anything that draws, like soup that draws, that your baby will have mucus or something when the
Is it
baby
food?
comes. Okay, so
So the thing is, if there's anything, especially for first timers, because most of these meets is these first timers that usually want to follow everything. So what I would say is, if you're not sure, ask questions.
Exactly.
And ask the right channel. Ask your nurse, the nurse that is attending to you, and antenatal. Ask the doctor. Ask questions if you're not sure before you go ahead. And some even tell you to drink abo. Okay.
Okay, so finally, what important advice would you like to give to pregnant women and their families to help ensure a safe and healthy pregnancy?
I would say that no two people don't experience pregnancy the same way. And it can be very disheartening when a woman is trying her best and then she's being compared to another woman, probably doing something else. So recently, there was a celebrity that posted a video of her working out, doing exercise, in the gym while she's pregnant, and it caused a lot of uproar online. A lot of people were giving negative comments as to, oh, look at this woman now, my wife now, she will not be able to stand up, derogatory comments. And that's very, very wrong because you don't know the situation that person is. You don't know how your own wife is dealing with it. So don't compare her to another person. And if she's having her mood swings and all of that, please be understanding. Sometimes it's not her fault. She don't just wake up and say she wants to start crying again. So I feel understanding, being more understanding, and it's not like an avenue for the woman to have back character.
Exactly.
So in as much as that one is there, as long as this is not her fault, don't feel ashamed, don't feel embarrassed. If you have an issue, talk. If you have anything that you're concerned about, ask questions. They'll listen to you because they're here to help. Right? And the family too should be try as much as possible to be supportive. Some things is not solved by God forbid.
Exactly.
It is not my portion. Yes, it is solved by taking actions that would lead to results. It's sorted by seeking medical attention.
Okay.
So that is why I'll still go back to, as a woman, as much as you can, start saving early if you can, so that in case of anything, you can have something that can take care of yourself because we value your life, we value the life of your child, and we want to see you healthy and see your child healthy as well.
Wow. Great advice. Like you said it all. On that note, we say thank you for coming on the program. We really had a wonderful time, like telling us in this how many minutes you've told us so many things. Like I've featured so many things already. Thank you for that insight and
Thank you
everything.
very
I'm
much.
sure people at home to understand and actually know better now how to handle pregnancy. Okay, so we've been talking with Olivia Onosike. She is a nursing student and she has told us a whole lot, like about maternal health and pregnancy, like a whole lot. If you missed that, you really missed. But let me just give you some tips, those myths that people actually tell us about pregnancy. They are all false, so they are all fake. Don't follow. Better eat your food very well. Eat it very well so that you have a healthy child. And then some of these things to do, ask questions. Anyone, in fact, the main thing is immediately you're pregnant, go for help, go to the hospital, make sure you register and go for regular visits, regular checkup. And with that, we have a safe and sound delivery. And let's go for this short break. And when we return, the program continues.
I don't know what it is, but she drives me crazy.
Marriage, a beautiful bond, but not without its battles. Behind every smile is a story. Behind every I do is a journey. Mr. and Mrs., the show that peels back the curtain on real relationships. No scripts, no filters, just truth.
I've become a better husband because I've learned a lot from the mistake of the past.
I had feelings, but I wanted to be sure.
Do I have to kneel down to marry a woman?
No, but just do the right.
Join us every week as we sit down with real couples to talk about the raw, the real, and the redemptive side of marriage. This is Modern Entertainment. It's an invitation to grow, to heal, and to love again. Mr. and Mrs. is about real love, real struggles, and real hope. Every couple has a story. What's yours? Join us on NTA Channel 5, the Unity Station, every Thursday at 7:30 p.m.
'Cause all of me loves all of you.
Hey friends, welcome to Kidi's World. My name is Oguntayo Ambrosiastina.
My name is Omarideris Erison, and today we're going to start off with our usual accent, and today our exercise is swimming.
Welcome to Kidi's World. My name is Oguntayo Ambrosiastina.
My name is Omarideris Erison, and today we're going to start off with our usual accent, and today our exercise is swimming.
This is still Good Morning Abuja. Yes, we've been talking and talking and talking. It's now time. Now we need to eat. We need to know what to eat. So let's learn awara today. Today on our cookery segment, we want to learn how to make awara. Do you know it? Have you heard of it before? If you do, if you don't, let's see it. Lovely Awara there. I'm sure you will try this one. This one is easy and like you can take it anytime, morning, afternoon, night. It doesn't have any effect on you. Yes, so don't be worried that maybe you add a little calorie. No, it's good to go anytime. Okay, now it's time to know what the weather would look like with our weather forecast. Let's see. Well, with our weather forecast, we've come to the end of yet another interesting episode of Good Morning Abuja. I'm sure you had a wonderful time. Like today, our topic was on maternal health regarding pregnancy, and I'm sure you were able to take a lesson also from our discussion because it will help in the long run. Okay, with that, we've come to the end of the program. Join us again, same time, same station. I remain Gladys Kudambu Vincent, and it's bye for now.